For many years, the term anti-aging referred primarily to the treatment of visible age-related changes. The approach was corrective, focused on reducing wrinkles, improving laxity, and addressing pigmentation after these signs had already appeared. In recent years, however, we have transitioned toward the concept of longevity. Longevity implies prevention, not simply living longer, but living well. In aesthetic medicine, this shift reflects a deeper goal. When we address longevity, we are ultimately addressing skin quality. Modern aesthetic medicine is no longer centered solely on correcting visible signs of aging, but on supporting the skin's natural biological functions to maintain long-term health, vitality, and resilience. As the skin ages, oxygenation decreases due to reduced microcirculation and less efficient blood flow, limiting the delivery of oxygen and nutrients to cells. At the same time, cellular turnover slows, leading to dullness, uneven texture, dehydration, and diminished radiance. True anti-aging begins at the cellular level. Restoring optimal conditions for oxygen exchange, hydration, and cell renewal enables the skin to repair, protect, and regenerate more effectively. This is the foundation of skin longevity. Geneo X is designed to target these essential aging mechanisms. By enhancing microcirculation, it increases oxygen availability within the skin, supporting cellular metabolism and overall skin health. It also significantly improves hydration, which is critical for elasticity, barrier function, and comfort. Beyond hydration and oxygenation, Geneo X enhances luminosity and vitality, delivering visible radiance without discomfort or downtime. By prioritizing skin quality and physiological balance, we support the skin's natural longevity. Now that we understand these principles, let us explore how they can be effectively applied in practice. Skin aging is a gradual biological process that affects multiple layers and functions of the skin over time. As this process progresses, cell turnover slows down, reducing the skin's ability to renew itself efficiently and leading to a buildup of dead cells on the surface. At the same time, oxygen delivery to the tissues decreases, limiting cellular metabolism and the skin's regenerative capacity. This decline is closely connected to changes in microcirculation, which becomes less efficient with age. When microcirculation is impaired, the transport of oxygen and essential nutrients to skin cells is compromised. As aging continues, collagen and elastin production decline. These structural proteins are essential for maintaining skin firmness, elasticity, and strength. Their gradual reduction results in visible loss of firmness, decreased elasticity, and the appearance of fine lines and skin laxity. In parallel, the skin barrier function weakens, increasing transepidermal water loss and reducing the skin's ability to protect itself from external stressors. A weakened barrier makes the skin more vulnerable to dehydration, sensitivity, and environmental damage. Additionally, inflammation becomes more persistent in aging. Skin chronic, low-level inflammation disrupts cellular communication and accelerates tissue degradation, further intensifying visible signs of aging and discomfort. Because the aging process affects multiple interconnected biological mechanisms, effective protocols must go beyond surface-level correction. Protocols must support regeneration, targeting cellular renewal, oxygenation, microcirculation, structural integrity, and barrier repair. Modern anti-aging trends are increasingly aligned with the concept of longevity programs, shifting the focus from appearance alone to overall skin function. Rather than addressing isolated aesthetic concerns, contemporary anti-aging strategies aim to preserve and support skin health over time. Longevity-oriented approaches recognize that healthy skin is the result of well-functioning biological processes. For this reason, modern programs prioritize maintaining cellular activity, tissue balance, and regenerative capacity instead of relying on short-term cosmetic correction. This evolution has led to the rise of protocol-based treatments designed to deliver consistent and measurable results through structured, repeatable approaches. Another key trend is the combination of technologies within a single treatment plan. By addressing multiple aging mechanisms simultaneously, such as hydration, stimulation, and regeneration, combined technologies deliver more comprehensive and effective outcomes. This synergistic approach allows practitioners to tailor treatments to individual skin needs while maximizing long-term benefits. At the same time, Non-invasive solutions are gaining priority. Patients increasingly seek treatments that improve skin quality without downtime, discomfort, or aggressive interventions. Non-invasive technologies support skin regeneration while respecting the skin's natural balance, making them ideal for long-term maintenance and longevity-focused care. Central to these modern strategies are oxygenation and microcirculation. Efficient oxygen delivery and nutrient exchange are essential for optimal cellular function and effective skin stimulation. Without adequate microcirculation, regenerative processes are limited and treatment outcomes are compromised. Equally important is the need to avoid chronic inflammation. While stimulation is necessary to trigger regeneration, excessive or prolonged inflammation accelerates aging and damages skin structures. Successful anti-aging and longevity programs strike a balance, activating the skin's natural processes while preserving comfort, integrity, and long-term skin health. Modern anti-aging trends are increasingly aligned with the concept of longevity programs, shifting the focus from appearance alone to overall skin function. Rather than addressing isolated aesthetic concerns, contemporary anti-aging strategies aim to preserve and support skin health over time. Longevity-oriented approaches recognize that healthy skin is the result of well-functioning biological processes. For this reason, modern programs prioritize maintaining cellular activity, tissue balance, and regenerative capacity, instead of relying on short-term cosmetic correction. This evolution has led to the rise of protocol-based treatments, designed to deliver consistent and measurable results through structured, repeatable approaches. Another key trend is the combination of technologies within a single treatment plan. By addressing multiple aging mechanisms simultaneously, such as hydration, stimulation, and regeneration, combined technologies deliver more comprehensive and effective outcomes. This synergistic approach allows practitioners to tailor treatments to individual skin needs while maximizing long-term benefits. For patients presenting with mild age-related changes, such as alterations in skin quality, uneven texture in large pores, fine lines, and minimal laxity, our therapeutic objective is not aggressive correction, but functional restoration and optimization of skin physiology. The core of the protocol includes 4 Geneo X Revive sessions, combined with 4 non-ablative, non-fractional laser sessions. Both treatments are performed within the same session, allowing for synergistic effects while optimizing treatment time and patient experience. Each session begins with approximately 15 minutes of Geneo X dermabrasion, which gently exfoliates the skin, removes dead cells, and prepares the tissue for enhanced absorption and stimulation. This step improves skin texture and promotes immediate luminosity. Following dermabrasion, a non-ablative, non-fractional laser treatment is applied. This step delivers controlled energy to stimulate cellular activity and collagen production without damaging the skin surface or causing downtime. The session is completed with 15 minutes of Geneo X ultrasound, which supports deeper tissue stimulation, enhances microcirculation, and improves oxygenation. Ultrasound further contributes to skin firmness and overall comfort. The recommended interval between sessions is 2 weeks, allowing sufficient time for tissue recovery and regenerative processes to take place. For long-term results, maintenance is essential. A monthly session combining Geneo X and non-ablative, non-fractional laser treatments helps preserve skin quality, support ongoing regeneration, and sustain the benefits achieved during the initial protocol. The Anti-Aging 2 clinical protocol is designed to combine advanced skin stimulation technologies to enhance regeneration, hydration, and overall skin quality. This approach uses either Geneo X Revive or Geneo X Hydrate, depending on the patient's specific needs. The protocol consists of 4 Geneo X sessions and 4 non-ablative, fractional laser sessions. Unlike other protocols, the sessions are alternated, ensuring balanced stimulation and allowing the skin to recover fully between treatments. This method optimizes regenerative processes while minimizing irritation or inflammation. Each alternating session begins with either a Geneo X treatment, which exfoliates, oxygenates, and hydrates the skin, and a non-ablative, fractional erbium glass type laser session, which delivers controlled energy to stimulate collagen production and improve skin texture, By combining these technologies in an alternating pattern, the protocol addresses both superficial and deeper layers of the skin. The recommended interval between sessions is 2 weeks, providing adequate time for tissue repair and cellular renewal. This schedule allows the skin to respond effectively to each treatment while maintaining continuous improvement over the course of the program. By following this protocol, patients benefit from enhanced luminosity, hydration, and firmness, supported by long-term regenerative effects. The combination of Geneo X technology and fractional laser treatments ensures a comprehensive approach, targeting multiple signs of aging while preserving skin health and comfort. Oxypod. Revive is a targeted anti-aging treatment formulated with key active ingredients designed to support skin regeneration, protection, and overall vitality. Red algae is rich in antioxidants, effectively neutralizing free radicals and protecting the skin from oxidative stress. Its nutrient-dense composition helps maintain a healthy, resilient skin barrier and supports natural defense mechanisms against environmental damage. Caffeic acid acts as a potent antioxidant with strong anti-inflammatory properties. It protects the skin from UV-induced damage while supporting collagen synthesis, helping to reduce visible signs of aging such as fine lines and loss of firmness. Retinol is a well-established ingredient that promotes cell turnover, improves skin tone, and encourages epidermal renewal. It helps reduce fine lines and enhances overall texture, leaving the skin smoother, firmer, and more luminous. Together, these ingredients work synergistically in Oxypod. Revive to combat oxidative stress, stimulate regeneration, and maintain youthful, healthy-looking skin. Brighten and even skin tone with Oxygeneo. Revive, a treatment designed to refresh dull complexions and restore a youthful glow. This advanced technology targets multiple signs of aging, reducing the appearance of fine lines while improving overall skin texture and appearance. By enhancing cellular renewal and stimulating the skin's natural regenerative processes, Oxygeneo Revive helps the skin look smoother, firmer, and more radiant. Clinically, the treatment provides a range of proven benefits. It promotes collagen production, which supports skin elasticity, firmness, and structural integrity. Collagen stimulation also contributes to a reduction in fine lines and wrinkles, giving the skin a more lifted and rejuvenated look. In addition, Oxygeneo Revive improves skin texture, reducing roughness, unevenness, and dullness, while enhancing luminosity for a healthier, more vibrant complexion. Because it works on the foundational processes of skin aging, Oxygeneo Revive is ideal for anti-aging protocols. It complements other treatments by boosting the skin's responsiveness and supporting long-term skin health. The result is a visibly revitalized appearance with skin that feels refreshed, nourished, and radiant. Oxygeneo Revive is the perfect solution for those seeking to brighten, even, and rejuvenate their skin while addressing the underlying causes of aging. Anti-aging with non-ablative dermal rejuvenation utilizes advanced 15 to 70 nn non-ablative fractional laser technology to target signs of aging while minimizing downtime. This approach delivers controlled thermal energy directly to the dermis, creating microthermal zones that activate the skin's natural wound healing cascade. By stimulating fibroblast activity, the treatment induces neocollagenesis and neoelastogenesis, supporting the production of new collagen and elastin fibers. These processes promote extracellular matrix remodeling, which is essential for maintaining skin structure, firmness, and elasticity. Unlike ablative procedures, non-ablative fractional lasers achieve these benefits without damaging the epidermis, making the treatment safe, comfortable, and suitable for all skin types. Clinically, the effects are measurable and impactful. Patients experience improved skin texture and tone, a reduction in fine lines, and increased firmness and elasticity. Over time, the skin appears rejuvenated, smoother, and more resilient with a natural, youthful glow. Non-ablative dermal rejuvenation is an ideal component of anti-aging protocols, either as a standalone treatment or combined with complementary therapies. By enhancing the skin's regenerative processes and structural integrity, it provides long-term benefits that maintain healthy, revitalized skin while addressing the visible signs of aging. The non-ablative, non-fractional Q-switched end YAG laser represents a highly effective modality for improving skin quality while preserving epidermal integrity. Unlike ablative technologies, it does not disrupt or remove the superficial layers of the skin. Instead, its primary effects occur at the dermal and structural level. Operating at a wavelength of 1064 nm, the laser is selectively absorbed by melanin, enabling it to target excess pigment and contribute to a more uniform complexion. Through controlled photoacoustic energy, pigment particles are fragmented without generating thermal damage to the epidermis. This mechanism significantly reduces the risk of surface injury, post-inflammatory hyperpigmentation, and pigmentation rebound, making it suitable for a wide range of skin types. Beyond pigment correction, the delivered energy penetrates into the dermis, where it stimulates fibroblast activity and promotes neocollagenesis. This biological response enhances dermal remodeling and strengthens the skin's structural framework. Clinically, the result is progressive improvement in texture, pore appearance, and mild laxity. The skin appears smoother, firmer, and more refined, achieved through physiological stimulation rather than aggressive surface ablation. This is the result of a patient who followed a combined treatment protocol designed to target multiple signs of aging and improve overall skin quality. The protocol alternates between Geneo X revive sessions and non-ablative fractional laser sessions, allowing the skin to benefit from both exfoliation, oxygenation, and hydration, as well as deeper dermal stimulation. Each treatment is spaced at a 2-week interval, providing sufficient time for cellular renewal, collagen stimulation, and tissue recovery between sessions. The combination of these technologies works synergistically. Geneo X Revive refreshes the complexion, improves skin texture, and enhances luminosity, while the fractional laser stimulates fibroblasts, promotes collagen and elastin production, and remodels the extracellular matrix. As a result, the patient experiences smoother, firmer, and more radiant. Skin fine lines are reduced, skin tone is evened, and the overall appearance is rejuvenated. This protocol demonstrates how alternating complementary technologies can achieve visible, clinically supported anti-aging results while supporting long-term skin health. For many years, the term anti-aging referred primarily to the treatment of visible age-related changes. The approach was corrective, focused on reducing wrinkles, improving laxity, and addressing pigmentation after these signs had already appeared. In recent years, however, we have transitioned toward the concept of longevity. Longevity implies prevention, not simply living longer, but living well. In aesthetic medicine, this shift reflects a deeper goal. When we address longevity, we are ultimately addressing skin quality. Modern aesthetic medicine is no longer centered solely on correcting visible signs of aging, but on supporting the skin's natural biological functions to maintain long-term health, vitality, and resilience. As the skin ages, oxygenation decreases due to reduced microcirculation and less efficient blood flow, limiting the delivery of oxygen and nutrients to cells. At the same time, cellular turnover slows, leading to dullness, uneven texture, dehydration, and diminished radiance. True anti-aging begins at the cellular level, restoring optimal conditions for oxygen exchange, hydration, and cell renewal enables the skin to repair, protect, and regenerate more effectively. This is the foundation of skin longevity. Geneo X is designed to target these essential aging mechanisms. By enhancing microcirculation, it increases oxygen availability within the skin, supporting cellular metabolism and overall skin health. It also significantly improves hydration, which is critical for elasticity, barrier function, and comfort. Beyond hydration and oxygenation, Geneo X enhances luminosity and vitality, delivering visible radiance without discomfort or downtime. The CO2 laser is a 10,600 nm wavelength ablative laser, highly absorbed by water, which makes it particularly effective for controlled tissue vaporization and dermal remodeling. In its fractional or hybrid formats, it creates precise microthermal treatment zones while preserving surrounding tissue, allowing for accelerated healing and significant collagen stimulation. For advanced anti-aging protocols, grades 2 to 3, characterized by deeper wrinkles, structural changes, and moderate laxity, we utilize a comprehensive regenerative strategy. Treatment begins with skin preparation, often incorporating Geneo X, Revive or Hydrate, to optimize oxygenation, hydration, and microcirculation prior to laser intervention. Creating a well-oxygenated and hydrated environment enhances tissue response and recovery. This is followed by a fractional CO2 laser session, typically performed once monthly, depending on clinical indication. Post-laser, we integrate 1 to 2 Geneo X sessions, occasionally up to 4, though we preferentially recommend 1 or 2, to support healing, improve comfort, and enhance overall skin quality. When multiple hybrid sessions are scheduled at monthly intervals, Geneo X treatments are positioned at 2-week intervals between laser procedures to maintain biological stimulation. At the completion of the fractional laser protocol, we finalize treatment with intradermal hyaluronic acid, most frequently Skin Vive 2-3 ml, to further enhance hydration, skin quality, and luminosity.